In this video, we are going to learn about coding of bypass procedures. In a normal bypass procedures, the body part bypass from is identified by character 4 and the body part bypass to is identified by character 7. That means if the bypass is from stomach to jejunum, the stomach is identified by character 4 and the jejunum is identified by character 7. However, in case of coronary artery bypass procedures, the body part bypass from is identified by character 7 and the body part bypass to is identified by character 4. That means in this example, the bypass is from aorta to coronary arteries. So aorta is identified by character 7 and coronary arteries by character 4. So if the coronary artery bypass procedures includes any excision for graft and that excision for graft should be coded separately. See, for example, in case of coronary bypass with excision of saphenous vein graft, this excision is always coded separately. So now let's apply all those guidelines. The patient came to the hospital for bypass procedures. Reverse right greater saphenous vein graft were brought from aorta to obtuse marginal and right coronary arteries. So here in this procedure, grafting is being done here and bypass from aorta to two coronary arteries. One is obtuse marginal and another is right coronary artery. So a graft and a bypass from aorta to two coronary arteries. So in this procedure, left internal mammary artery was loosened and brought down to left anterior descending artery. So bypass from left internal mammary artery to left anterior descending artery. So in third procedure, bypass is from abdominal artery to coronary artery. So total of 4 coronary arteries are bypassed along with saphenous vein graft. So the root operation for coronary artery bypass procedure is bypass. So we should search this term bypass in the index. So in the index, we should search for coronary arteries under artery, coronary artery. So here 0 to 1 for 1, 2, 3 and 4 coronary arteries, the table is same 0 to 1. So with this 3 character code, we should go to the table 0 to 1. So in the 0 to 1 table, the bypass is from aorta to coronary arteries, 2 coronary arteries. So aorta to 2 coronary arteries. So the character 4 will be 1. The approach is approach. And autologous venous tissue is identified as character 6 device value. And the qualifier is identified by body part bypass from that is aorta. So next procedure, bypass of coronary artery from left internal mammary artery. So from left internal mammary artery to coronary artery, single coronary artery or one artery. So 0. That means from 9 to 0. And the approach is open approach. Here no device. It should be coded by device. Character 6 is coded by no device. And internal mammary artery 9. So bypass from internal mammary artery to coronary artery, open approach and no device. And in case of bypass from abdominal artery to coronary artery, see abdominal artery to single coronary artery. The approach is open approach, no device. So 0, 0, Z and F. And because grafting procedure was done, that should be coded separately. So excision of right saphenous vein. So here the root operation is excision. So under excision we search for vein and under vein saphenous vein. So right saphenous vein. The table will be 06B. So 06B table, and the fourth character is body part. We should search for saphenous vein. So saphenous vein is P here, P, and the approach is open approach, no device, and no qualifier. So this is how we code for coronary artery bypass procedures. Thank you.